All right, I have a very special guest with me today, Dr. Peter Breggin. He is a world-renowned psychiatrist, prolific researcher, and author. He has spent his career standing in the gap for those who need a voice, for those who are vulnerable. Not only has he served countless adults, children, and families, but he also was instrumental in stopping the practice of lobotomy in the US. He was instrumental in stopping abuse of children of color in psychiatric experiments in the US in the 90s. And he has been a champion for informed consent and for patient rights. And even at age 84, he is still making huge waves for all of us who need him to speak up on our behalf. So Dr. Breggin called me a few weeks ago with an idea to have older adults speak up for health freedom during the coronavirus because of what that means not only for today, but for our future. So Dr. Breggin, you asked me if we could create a way for this to happen. And I want you to just share a little bit about what your message is to lawmakers, to community leaders in positions of influence about the older adults and their message during this time.
Thank you so much, Leah. You're picking this ball up in a way that I could not do. It's a great gift to me and to the world. Thank you very, very much.
Thank you, Dr. Breggin.
It's really a pleasure to be working with you. I'm 84 years old. My wife is a mere 69, and her mom is 94. So we have a household, we live together. I love Ginger's mom, and we have a household of one young dog, two older dogs, and then the three of us. And we are acutely aware of how much people are suffering from the shutdown, how much they're suffering from not going to school, the kids especially. We're aware of not being able to see our grandchildren. Our grandchildren asked, can we come see you? And we had to say no. They can't come from another state and just march in and visit with us. We see people who are so scared they're wearing masks outdoors or masks in their cars. We hear such contradictory messages and know that they're disturbing people. And we see the great decline of our economy. And it's as if the land of the free and the land of the brave is neither so free nor so brave anymore. And we want to help reverse that. And personally, we don't want our vulnerability at our ages to lead to the shutdown of the economy and the social life and the religious life, even the political life of the nation. So we wanted to see if we could just gather a lot of older people on a petition. And by older, we mean 50. There is a leap of the vulnerability at around age 50, but it's a very small leap. It's still very few people are going to get deathly ill, even if they get the virus. And even at our age, if we're healthy, I would say the risk is way less than 5% of us dying from this virus, even at our age. And if we have a lot of comorbidities, then according to the CDC, our death rate might be 5%. But actually, when you read what the CDC is doing, it's probably a lot lower than that. So overall, whether you're looking at us or you're looking at the whole culture, we want to say, don't shut down. We know we have greater vulnerability than others, and we'll take care of ourselves. If politically it's chosen to give aid to older people, we don't need any in particular, but some older people would need help. Well, let it go to the older people, but don't keep working age people from going to work. Don't keep children from going to school. So we are saying, don't use us as your reason for imprisoning and controlling the rest of society. And let's really become the land of the free and the land of the brave again. it's not only good for America, it's good for the whole world that we not become the victim of the shenanigans, the control around the virus.
Yeah, so we have statistics from the CDC that prove what you were saying, that really the risk of fatality is an estimated 0% before the age of 20. And then
Good
before the
point.
age of 50, it's only 0.02%. So you still have, before age 50, you have greater than 98% survival. And then once you get to age 50, it bumps a bit to 0.5%, so a half a
Exactly.
percentage. Then it climbs more at age 70 to 5%. And you're saying that it's overwhelmingly obvious that those who are vulnerable are in specific age classes, but that doesn't mean that those who are vulnerable are asking for these shutdowns. So do you think that the cost of the shutdowns are too high for the benefit of what we're seeing?
Yes, I've actually studied this. I've written a lot about it on Bregan.com, where we have our coronavirus resource center. And I'm going to have a book co-authored by Ginger coming out within a couple of months on the exaggerated assault on our freedoms being made by the governors, being made by the politicians in the government like Fauci. And there's just no evidence that these draconian measures are actually doing much. I mean, we might be able to temporarily delay the spread of the virus, but then it's going to spread maybe even more rapidly once you release these draconian measures. So it isn't really a great advantage at all. And we basically need to go about our business as well as possible. There's an old public health axiom that the young Turks don't want to pay any attention to, and that is that a society that goes about its business as normally as possible will always be in the best position to deal with a crisis, whether it's an epidemic or a war or anything else. We need to get back not to a new normal, but to our original normal and to even increase our liberty.
Well, thank you so much for that message and for standing up for everyone as an older adult, saying, don't do this on our behalf, that we care too much about the legacy that you're leaving. And so if you are listening and you are over the age of 50, you can click to send
Well,
the
50 or older. I'd say 50 or older.
Okay, so 50 or older. So if you are 50 or older, you can click to send the message that Dr. Peter Bregan has signed first to your own lawmakers, to your governor, to your state representative, your state senators, to let them know that you as an older adult do not want the economy shut down, the educational institutions shut down on your behalf. So thank you so much, Dr. Bregan, for spearheading this message. And we look forward to seeing the waves that this can make on behalf of our children and future generations.
Leah Wilson, thank you so much for your organization, Stand for Health Freedom. It's just a wonderful thing that you're doing.
Thank you.